Throughout history, medicine has advanced through collaboration. Knowledge grows when it is shared. Better patient outcomes belong to everyone. This is L.APN acupuncture nerve release during a follow-up visit. The first treatment released the perineal nerve from the low back to the toes, but did not fully resolve the numbness or the drop foot. In this session, I modified the treatment approach to more thoroughly engage a persistent area between the heel and ankle. The goal was to achieve a complete release of fluid entrapping the nerve for resolved function and sensation.
After my first treatment with Jennifer, I had feeling in my toes for the first time in 3 years. And after the treatment today, I have feeling in my entire foot, and I can walk at the speed of everybody else instead of...
Active Perineural Neuromodulation is a precision feedback-guided acupuncture method that engages nerves and surrounding neurovascular structures to help release entrapment, restore signaling, and improve neurological function. It is especially useful for complex neurological presentations, chronic pain, and functional limitation.
I've had a remarkable improvement. I've gone from quadriplegia with the central cord of Jennifer's acupuncture. The things I've noticed most with her acupuncture, and I've only had 4 treatments, is the ability to get my hands up. Before I saw her, I could only get to here. After the first visit, I got up to here. And now I can get up where I can scratch my head. My arms would always stay bent. I can now get them relatively straight. My gait's improved.
APN requires appropriate clinical training, anatomical knowledge, and integrative diagnosis. Practitioners learn to bridge the internal medicine principles of classical Chinese medicine with modern biomedical science, creating a more clinically relevant framework for understanding complex conditions. With more than 20 years of clinical experience, extensive travel throughout China, and ongoing collaboration with Yunnan University of Chinese Medicine in Kunming, I have transitioned from clinical practice toward teaching, research, and publishing. My teaching combines lectures with practical, clinically useful methods for licensed practitioners working with complex neurological and complicated internal medicine presentations that have plateaued standards of care without a path towards wellness. In addition to classes offered at my Mountain Farm teaching studio in Green Mountain, North Carolina, I am interested in collaborating with professional organizations, associations, schools, and practitioner groups in the United States and internationally. Hosted training details, current class offerings, and professional education information are available through my website.